Apophysitis. What is calcaneal apophysitis? This condition, otherwise known as Sever's disease, is a painful condition that occurs in the heel bone, calcaneaus, in patients generally between the ages of 10 to 15 years of age. This is a disease of the growth plate of the bone. The bones have what is known as a growth plate. It is from this growth plate that each bone continues to form, eventually becoming adult bones. That is why this condition is seen during development at ages 10 to 15, this is just before the bones fuse and finalize in their appearance. What causes calcaneal apophysitis? It is thought that the tension created by the Achilles tendon on the heel bone pulls that section of bone away from the remaining section of heel bone at the level of the growth plate and thus creates pain. Because of this mechanism, this condition is also known as traction apophysitis. My patients are usually athletic, playing a sport that requires running and jumping on a hard surface. It is this excessive strain on the heel itself and the Achilles tendon that sets this off. Many patients will relate that they had absolutely no pain in the heel until their season began. Symptoms of calcaneal apophysitis. Typically, the young patient will complain of pain on the inside and outside of the heel bone. Although not impossible, pain is usually not evident on the bottom of the heel. The area may be very tender. It may occur in either heel or both heels. The affected heel may be slightly red and swollen, however, in many cases the heel appears normal. The pain will be worse during practice and will generally only improve somewhat when not participating in their sport, only to worsen once they play again. Diagnosing calcaneal apophysitis. Diagnosis is made on the clinical history. Pressing on the heel from side to side will result in pain. Pressing on the bottom of the heel generally will not result in pain. X-rays should be taken to rule out a fracture in the area, but the growth plate looks the same with or without this condition. Treatment of calcaneal apophysitis. Walking on an injured area tends to delay healing, so the pain of an apophysitis can linger. As much as the child does not want to hear it, in many cases rest is necessary to reduce the pain. This may mean giving up their sport. Depending on the degree of pain, the patient may try icing the heel both before and after practice. Anti-inflammatory medication may also be helpful, taken 30 minutes before practice. Strapping the heel in a basket weave type strap can also be very effective. A podiatrist or athletic trainer should be able to demonstrate how to apply the strapping. Adding gel heel cups to the athletic shoe helps in two ways. The first is that it cushions the heel against impact, and secondly, the heel cup decreases the excess tension on the Achilles tendon, thus reducing the pull on the apophysis. In any event, this is a self-limiting condition and will eventually resolve itself. The only variable is how long it will take to resolve in a given individual. Read the full article at www.foot-pain-explained.com/apophysitis.html.